Namely, is VA's system of care and benefits improving the health and wellness of the veterans that are suffering from mental illness. On behalf of a grateful nation, we've invested heavily in this system over the last decade to improve access and make treatment options that experts say are effective more readily available. But the question remains, are veterans, especially those returning from combat with the invisible wounds of war, on a road to recovery and able to live full and productive lives? Recovery, restoration, and wellness. These should be the overarching objective of all VA's programs. Yet when I look at the trends in disability ratings for veterans with mental illness, I see a very confusing picture. On one hand, we have a medical system that boasts of evidence-based therapies, improved access, and high quality of care. And on the other hand, we have data from VA indicating that veterans with mental illness only get progressively worse. These confounding facts raise the question, are VA's health and disability compensation programs oriented towards VA's mission of recovery and of wellness? And I'm not the first who's noted this trend or suggested the need for closer integration of VA programs. In 2005, a report from the VA Inspector General concluded the following, and I quote, "Based on our review of the PTSD claims files, we observed that the rating evaluation level typically increased over time, indicating the veteran's PTSD condition had worsened. Generally, once a PTSD rating was assigned, it was increased over time until the veteran was paid at the 100% rate." Close quote. We have a 2007 report from the Veterans Disability Benefits Commission, and we'll hear from the chair of that commission on our second panel this morning. It recommended, quote, "A new holistic approach to PTSD should be considered. This approach should couple PTSD treatment, compensation, and vocational assessment." Close quotes. Most recently, we have the administration raising red flags. In its fiscal year 2010 Performance and Accountability Report, VA commented on how well its Veterans Benefits Administration collaborates with the VHA when providing services to veterans with mental illness. The report suggested that with recovery as the essential goal to helping veterans with PTSD, that perhaps VBA and VHA were working at cross purposes. Let me quote from that report. "The advent of the recovery model as central to the treatment of mental health and disorders, the current system fails to support and may even create disincentives to recovery." Close quotes. Today we're going to move beyond the numbers that simply tell us how many veterans use the system and get into the fundamental question of whether they are on the road to leading full and productive lives. For veterans who don't seek VA care, we need to know why they're not seeking that care. We need to know if there are inherent disincentives to recovery. We need to know if the quality of treatment provided at VA is a reason to seek care elsewhere. And we need to know what is effective and what is not effective. Quoting from a recent policy paper from the Wounded Warrior Project, VA's focus on the high percentage of veterans who have been treated begs such questions as, how effective was that treatment? And how many more need treatment but resist seeking it? And I couldn't agree anymore. It's our duty at this committee to ask these tough questions, and the veterans for whom this system was created demand it of us. We're fortunate to have with us on our first panel Mr. Daniel Hansen. Dan served in Iraq, then came home troubled in mind, trying to cope with the loss of so many of his fellow Marines. His is a story I hope everyone listens to closely today as a cautionary tale of where we may be inadvertently headed. Looking back, Dan has some interesting thoughts of what it would have taken him to get into treatment sooner. And it's just as important, he's got something to say about how he ultimately, found help outside the VA system.